Now, with food therapy, are we talking about like a particular ingredient or are we looking at a recipe as a whole? Like, how does that?
You can do both. I mean, as far as for a specific ingredient, we do think there are, especially for dogs, right? For dogs and for cats, they're specific in the types of food they want to eat. So we could say, well, dandelion greens and radishes are great for that problem. But we have to decide what would this species, what's also species appropriate for this animal to eat. So for people, we may want to have a salad, but for the dogs and cats, it's not quite what they, so to get the same effect, you think of what specific food. So for example, in our Chi Dog diets, we thought, okay, well, the turkey as a whole food is naturally cooling to the body. So a lot of our chronic inflammation conditions, we benefit with turkey just as a single ingredient. Whereas we can also use pork. Pork is a neutral ingredient. But the nice thing from a Western medicine perspective is pork is often used for conditions of inflammatory bowel disease, food allergies, whenever we're worried about an allergy, because pork is usually novel protein for most animals here in the US and for other parts of the world as well. Just it's a common protein. It's a protein that they have not commonly seen before. So we use that as a whole food ingredient, albeit it's neutral. So you can build cooling ingredients to go with it. For example, we use the cooling ingredient barley to go with our pork diet so that we can kind of couple that and make it a little more anti-inflammatory. So we get the benefit of the novel protein, which is what Western medicine wants. And then also a cooling diet so we can get anti-inflammatory to benefit for a lot of these chronic inflamed GI conditions, a lot of these chronic skin conditions. So you can kind of build it either as a single food, like I know this single food is good, or even better would be build a full recipe around it. How can I really get, for example, we use a lot of beef when we want a real hydrating diet, and that can be for diabetics, for chronic dry cough, those chronic, even like dandruff, like anything that's internal dryness. We'll think, how can I build a recipe around this food that's great for dogs and cats to eat, that's species appropriate, that can also be beneficial for their body from a food therapy perspective, and that they would like to eat. That's kind of, we need to have that component in there.
And is there any limitations to food therapy? Can it be applied to every single dog or?
Well, yeah, I mean, we try to, and that is the goal, right? That's the limitations just and specifically for dogs and for cats. Cats, more so than dogs, we worry about palatability. Do they like it? Because, we can kind of say any person who's had a cat who could be they tend to be more finicky. That is by their nature. Right? They're similar to horses in the sense that they can be more finicky, and that's normal. That's part of their nature. The other thing that we see is with dogs is that sometimes they'll have, and cats too, but I clinically in practice see it a lot with dogs, that they'll have problems with specific allergies or concerns of allergies. Sometimes we don't know 100% if this dog is allergic to X ingredient, but we have a reason to be concerned about it. So we're probably not going to build that into a recipe. So we think about palatability, we think about allergy. Those are kind of the biggest limitation. And of course, species, right? We're not going to feed a dog a kale salad, for dinner. It may be great for us, but for our species, we have high meat, low carbohydrate. That's one of the tenets in food therapy, related to species that we try to, I guess I'm going to be honest, that we try to correct with that. We think the Western medicine diets can tend to be very high carbohydrate sometimes. So we really try to get a diet that's not quite so high in carb. It's kind of one of the principles.
And you mentioned that you use this in your practice quite a bit. Is there any examples that you could tell us about how food therapy has really changed a dog?
Oh God. Yeah. There's so many that I would say routinely, I really should have taken the before and after picture, but I never want to jinx myself on the before picture. So I never do it. But then when they come back and they're improved, you're like, oh, I really, yeah, sometimes I've had to use food therapy as the sole treatment when we don't have a lot of other options. And that's kind of when it's really been, when I've really seen a dramatic improvement. For example, I had a dog who had gone to many doctors trying to get a fairly rare viral growth in the mouth that was fairly uncommon in our area in Southern California. And they'd gone to just tried therapy after therapy, Western, Eastern, mostly Western. They'd kind of gone through the gamut of all the pharmaceuticals. And this dog was not one that I could do acupuncture on because it wasn't amenable to that. Didn't really want you getting that close to it. And we also had some limitations with some of that because it was an oral problem. So the client honestly had problems putting things in the mouth for this dog. So the only thing we had was food. So we just said, okay, we're going to do, and this is before we formulated our diets, we did a lot of home cooking. So I said, okay, let's try a home cooking diet. That's all we got. This is going to be a food therapy case. And so that was the only change we were able to make. And that dog, recovered in months. I mean, resolved, like So things like that kind of go, it's the eye openers, but then more consistently on a daily basis, what I really try to focus on is, especially when we have a dog who's got a problem with their food, because that's a problem that owner and that dog deals with every day. Right? It's not something that you can just come in next week. If they're not eating, that's a problem this morning. That's a problem tonight, So we really focus on what I've seen consistently is when we allow that dog who's not eating, or maybe they're eating and they're having GI upset, or maybe they're not gaining weight, or they're gaining too much weight, anything that has to do with sort of obvious with food. Those are the dogs that we always start with food therapy. I mean, we've got it, especially if they're on a processed kibble diet, whether it's prescription, even if it's, quote unquote, the really high end or expensive, because they've got a lot of marketing behind them, those type of diets, we got to get them off the kibble, right? We got to get them on real food. And so that we're doing routinely on a daily basis. So a lot of our pancreatitis dogs, I've seen incredible improvements. Inflammatory bowel disease dogs, even like liver enzyme dogs where their liver enzymes are elevated. And so we're focused on the liver as an organ. If we couple that with I think it was an anti-inflammatory diet, which would be a cooling diet, right? So we try to do like a turkey-based diet or a pork-based diet if we're coupling it with some other cooling ingredients along with that. Even a beef-based diet that we're coupling with some cooling ingredients, then we can really see some improvements. But I think the biggest take-home is allowing our dogs to eat food, good quality food, can be a major change in their health, right? Both preventative medicine as well as turning around chronic inflammation. And that's what I see on a daily basis in practice.